All right, here we go. Good evening and welcome to Showtime TV. I'm your host, Omar Rashada. Today's topic is a very serious topic. It's called suicide awareness. And I have two distinguished guests. So I'm going to call them by their first names because I don't want to mess up their last names. We have Latoya, licensed clinical social worker, and with the Mental Health Association Delaware, we have Jennifer. Ladies, good evening and thank you for being a guest on tonight's program.
Thank you for having me.
Thank you for having me.
Okay, well, we'll start off with Jennifer. If you could just briefly just introduce yourself, what agency you work for, and what is your role, and then we'll go with Latoya.
Sure. As Omar mentioned, my name is Jennifer Smolowitz, and I am the project director for suicide prevention at the Mental Health Association, otherwise known as MHA. We are a statewide agency, and we are an affiliate of Mental Health America. So if you hear the MHA thrown around, we are an affiliate of them. We are a statewide agency that does education, advocacy, and support for various mental illnesses and suicide awareness. And my role with them is to oversee all of the suicide prevention efforts, trainings, the Delaware Suicide Prevention Coalitions, a lot of our conferences that we do that are suicide prevention related.
All right, Latoya.
Yes, my name is Latoya Congolo, and I'm a licensed clinical social worker, and I'm the co-owner of Work-Life Behavioral Health and Professional Training located in Glen Burnie, Maryland. We provide outpatient mental health services for anyone from ages 4 all the way up to the geriatric population. We also partner with our local crisis team where we provide suicide assessments, and we also make referrals to services. And we also do contract for safety.
All of a sudden they have an injury that sidelines them. That could be a huge risk. So any financial loss, personality loss, job loss, relationship loss. So anything like that can definitely be a risk factor. Right. We can also start looking at some of the ACE factors, the adverse childhood experiences. The higher somebody may rate on that scale, the more ACE factors they may have. There may be an inclination that they might be more at risk of suicide. Not always the case, but it does sometimes happen, especially if there's a lot of childhood trauma that they're trying to process. A huge risk factor is if they have attempted in the past, and also if they've recently lost somebody to suicide, a friend, a loved one, somebody that means a lot to them. A lot of times this could even be a celebrity or their favorite author, someone who they really look up to. And also a huge risk factor as well, in addition to that, is if they have the access to the means. If they have the access to means, there's that worry that risk is imminent. So we want to make sure that we're doing everything we can to intervene when any of those are in place. And okay. I could really go on, so I will get back to that if you need more.
Okay, great. Latoya, I know prior to us having this show, when you and I were texting each other, you had, Omar, you got to talk about suicide screening. So you want to talk about what is the suicide screening process for those who may not know who's watching?
Well, so the suicide screening is really just a set of questions for us to determine just how severe the suicidal thoughts are. And just as Jennifer mentioned, the means and the access to actually follow through with the ideations. So it can be as simple as asking questions such as, do you have a history of depression or mental illness? Because depression and other mental health disorders can intensify those feelings of wanting to take your own life. Have you ever had thoughts of suicide, as Jennifer mentioned, is another key question. Do they have a plan? Have they created a plan for suicide? Are they taking any medications? Some medications, if taken in large quantities, can cause fatalities. Often if they're using drugs and alcohol, substance use disorders can also put someone at high risk for suicide. So those are some of the screening questions. And depending on how many yeses they have, then that determines just how high of a risk they are. And it gives us clinicians an idea of what approach we need to take. Are they safe to go home? Do we need to put a safety plan in place? Or do we need to call 911 and have this person taken directly to the hospital for further psychiatric evaluation?
You know, Jennifer, you mentioned something that was crucial. You mentioned job loss. You mentioned loss of a family member. Man, when this COVID thing came out, I mean, my goodness, I mean, this is taking people left and right. And people are losing jobs. People are losing their homes. So have any of you two saw an increase in maybe suicide attempts or suicide deaths as a result of COVID-19?
I can't speak to the specific data to it, as our data always is about a year or two behind when we can actually do a full report. But I do know that there has been a huge increase in the calls to a crisis lines. And
Right.
also with telehealth, there's also been more people reaching out for numbers. I know at our agency, we have an INR, an information and referral line. And I know that we've been receiving more calls of people trying to identify who they can go speak with or a place that they can go to receive help. So I know that while we haven't seen specific numbers that show that there has been an increase due to the COVID implications, I know that that number is coming. I'm actually
Right.
scared to see the data in a few years because
Right.
I don't think it's going to look good, but
Right.
we're just doing everything we can to support those so that we can try to keep those numbers as low as possible.
Okay. So you have anything you want to add?
Yeah, I would definitely add that I too don't have numbers, but I can say anecdotally in my practice that I've seen an increase in stress related to work, financial difficulties, relationship issues as a result of being cooped up in the house with your loved ones a little more than usual. So these are some of the risk factors, but we're seeing it more commonly now with the pandemic. Definitely financial and relationship problems are at the top of the list for many of the clients that I'm seeing.
And I'm glad you mentioned, sorry to interrupt, I'm glad you
No, no,
mentioned
that's
the
good.
relationship problems because I know that we're seeing rates increase in among domestic violence cases and also with child abuse as well.
Mhm. Wow.
And even with child abuse, that there statistically there are less reports being made. However, it's because teachers don't have their eyes on kids, the police aren't involved, so there's not much community contact to where the people who would normally make those reports aren't seeing the kids. So it is definitely a concern. That a lot of kids are at home with no adult outside of their family monitoring their well-being.
Jennifer, you mentioned something about data, and as I was preparing for this show, one of the things that popped in my head was on a local level here in Delaware and on a national level across the United States of America, how prevalent is suicide?
Yeah, so it's definitely just the reported cases alone. And I say reported because in order for something to count in the data, it has to be
Right.
reported
Right.
by the medical examiner. So just on the reported data that we have in Delaware, it was the 12th leading cause of death, and nationally it tends to be the 10th to 11th leading cause, depending on the year. And just to compare the rates, Delaware specifically, and this data again is back to 2018, had a rate of 11.45 deaths per 100,000 people, whereas the national average was 14.2 per 100,000. So the rates are definitely higher. I think any rate higher than zero is too many, personally. So we're definitely seeing way too many people. In Delaware, we're losing a person to suicide on an average of every 3 days or so.
Wow.
Way too many.
That's definitely a lot. I want to talk about one of the thoughts that also popped in my head was men versus women. I'm not sure who commits suicide the most, men or women, but also wanted to know in terms of men and women who commit suicide, are they committing suicide because of the same reasons? Maybe you mentioned relationships, loss of job, maybe loss of a home. So are more women, when women commit suicide, is it the same reasons as men, or is it two different reasons? If that question, hopefully that question makes sense.
Mhm.
It does.
You've been in an interview,
Yeah,
all
it
kinds of
makes
questions pop up in your
yeah.
head.
No, it makes sense. And what I'll say is, and I'll let Jennifer add to this, what we see is that women have a higher rate of attempting suicide. However, men are 2 to 3 times more likely to succeed at committing suicide. So the reasons, I'll say this too, the reasons do matter based on gender and age. And when we get to talking about kids, you're talking about bullying and, social media, and that, cyberbullying is more of a reason why kids attempt suicide. So, gender differences, I'll let Jennifer speak to that.
Yeah, and to Latoya's point, males do have a higher completion rate. They do die by suicide more frequently because of the method that they use. So they're more likely to use more lethal means, whereas a female is more likely to use something that there's a better chance of intervening once an attempt has been made. I think the reasons why could be the same, but they could be different. A lot of times, women feel more comfortable talking to others about what's going on. They don't feel like they need to internalize a lot of things. And while men are becoming more open, it might not be at that place yet for them. They might not feel comfortable going to support groups or talking openly with friends, whereas women tend to do that more frequently and feel it's more accepted socially to do that. We're also seeing, and you mentioned age, elderly white males actually commit or die by suicide more frequently as well. They have one of the highest rates. So that's something to keep in mind as well. We are seeing higher rates among males, and it's typically the elderly that we're seeing the highest rate. Not that we're not seeing it across the entire age span.
Mhm. And what I would add too is that women are more likely to have more like the passive suicide, or maybe more verbal cues, like Jennifer mentioned, like, I just can't take it anymore. My life is over. I want to die. You know, just expressing it more verbally than a man would.
Yeah.
So,
And I
so
think the
I'll-
society
sure.
pressures are changing too. I think it's becoming more accepted and more normal, where it might not be the man who's the head of the household. They may be staying home more, where it might be the woman going out and earning the money and doing all those things. So I think as societal norms start changing, we may see the rates starting to reflect that, but that's inconclusive right now.
Right. Getting more into the variables. We mentioned gender, we mentioned age, but also I want to touch on culture because you know, being an African American man, I really never really heard too much about suicide in the African American community. So both of you ladies, how often or how prevalent is it that suicide exists in the African American community?
Yeah, it's scary for me because I'm seeing it more and more, especially in young children. I mean, we're talking elementary age kids, and even you know, nationally, the numbers are on the rise for Black children ages 5 to 11, where they're showing that more kids are attempting suicide, and the more of them are Black. Oftentimes it's, you know, kids express having a lack of support at home, or not having someone to openly discuss their feelings with. You know, it's that whole stigma around, you know, mental health, or not feeling normal, or feeling like I'm going crazy, and they don't want people to perceive them as crazy. So it's really about them not being able to express those feelings openly, and internalizing a lot of those feelings.
So Latoya, this is just a follow up. Do you think that at the dinner table, well, I guess a lot of us really don't eat at the dinner table anymore. Everybody eat in a separate room, but in home discussions and family discussions, do you think that we African Americans even talk about suicide?
You know what? I think that there are a lot of things that we probably are starting to talk about more than we had in the past. I definitely encourage family members, and I usually tell family members it's okay to ask your loved ones on a scale of 1 to 10, are you having any thoughts of suicide? It's okay to ask those questions, and to ask it in a non-judgmental, compassionate way. But I would encourage anyone, you know, because we all are dealing with stressors and life, you know, when we got to meet life on life's terms, it's not uncommon for us to feel depressed or anxiety, or maybe even have thoughts of, you know, if I weren't here, then maybe things would be a little bit easier for everybody. But we got to make it a norm to be comfortable having those conversations.
Okay. And Jennifer, you have anything you want to add?
Yeah, I think there's definitely some shifts happening among various cultures and even various faiths and religions. I know that we have people in our trainings all the time who will say, my church doesn't talk about this, or I did a presentation at a mosque one time, and it was the first time that they invited somebody in to really have this open conversation with them. And it was so nice to see that people are becoming more accepting of talking openly about mental illness and suicide, and just not normalizing it to the fact that it's something that we're going to talk about every day, but being okay having those conversations. So I think to Latoya's point, those shifts are starting to happen. Those conversations are starting to happen more. We're encouraging people to reach out. So if we're encouraging people to reach out, we also have to have the resources available for them to reach out to, and the education available. How do I know if somebody's going through something, and what do I do? Maybe I don't have to call the police, or maybe I don't have to call a crisis. Maybe I can just call somebody else and get them connected with a teacher or their parent or whoever that might be.
Right. I want to stay with Jennifer, and then Latoya, you can add in. Latoya, you touched on this a little bit, but I want to talk about warning signs.
Mhm.
I mean, we're all in the field, so we may be able to identify some warning signs, but for a family member or a friend or a colleague who may not be into the social service arena, human service, social work arena, whatever you want to call it, educate them who are watching in terms of what are some of the warning signs that may indicate that a friend of theirs or a loved one of theirs, family member of theirs, have warning signs that they may be contemplating about suicide.
Sure. There's definitely a ton. I think we'll start by going over some of the feelings that a person may express or
Okay,
show.
great.
They may talk openly about feelings of hopelessness, feeling worthless, guilt, shame, helplessness. You may hear them say that they feel like they're kind of drowning, they don't see their way out. There's a black hole they can't see their way out of, quicksand, however you wanted to explain that. Feelings of they're not good enough, they don't want to be a burden to you. Again, they might feel like they're worthless or not able to live up to the standards that they set for themselves or other people may have placed on them. And I mentioned earlier with that loss of identity, this could be, again, maybe they made a mistake and everything that they've worked so hard for is starting to be taken away from them because of some of their actions, or losses in relationship can be huge. So if you see that somebody's going through a major life change, taking the time to ask them, how do you feel about that? Because somebody might feel okay with it and be able to move on to the next thing. But for somebody else, it could be a major crisis and a major change and shift in the way that they do their day to day. If you hear somebody talking openly about giving away their possessions, if they're making statements like they don't want to be here anymore, soon you won't have to worry about me, you always want to make sure you're asking clarifying questions. What do you mean by that? Tell me more about that. Any major changes in their personality. So it's not just worrying about those who go from happy to sad, but also those who go from sad to happy. And this is a point we always like to put out there because sometimes a person may show signs of improvement right before a suicide attempt because they've come to terms with their decision. So yes, we want to worry about our friends who go from happy to sad, but going from sad to happy might be a huge red flag as well. Changes in their behavior. If they're typically pretty passive and all of a sudden they're more aggressive, they're starting fights, they're getting into trouble at school or at work, with the law, whoever that might be. And really just anything that, if they're not acting the way you typically know them to be, you want to ask those follow-up questions. If something's giving you that bad goosebump feeling, take the time to say, let's talk, what's going on? I'm here for you. Because we never want the one time we say, oh, I'll catch up with them tomorrow, or they must just be having a bad day. We don't want them to feel alone in that moment. So if you see something, say something. I know that's a phrase that's used for a variety of different things, but if something's making you feel like something's not right, taking the time to stop what you're doing and follow up in that moment.
Yeah, I think Jennifer touched on a lot of the behavioral cues, the emotional cues. 70% of people who have, thoughts of suicide, they usually give someone a warning, whether it be a family member or friend. And it's really important for family members and friends not to sweep it under the carpet. We have to be assertive in speaking up and expressing our concerns for people and, and persuading them to get the help that they need. But when we talk about behavioral cues, Jennifer had mentioned someone who's, giving away their prized possessions, getting their affairs in order. Now they have a will established, or they're taking out life insurance policies. They're socially withdrawing, just seeing changes in their mood and their behavior. But I want to share a story of a client that I had worked with very early on in my career, in my early 20s, just out of undergrad. This client had been in and out of the psychiatric hospital for suicidal ideations for years, had a very lengthy history. He was in outpatient treatment. We're doing community support services with him. And I had gone to his house for a home visit, and he had, I had just commented on how beautiful I thought his aquarium was in the living room. And he said, oh, you know what, if you want it, it's yours. He offered me his aquarium, and I'm like, no, I can't do that, because it's unethical, right? We hadn't heard from him in a couple of days, and, we had contacted his emergency contact. His loved one went to his house and found him. He had hung himself. And I had beat myself up for that for so long because I saw that he was a little more elated. He was, offered me his aquarium. I had saw the change in his mood. He just seemed a little happier than usual. But it was a learning experience for me that you can't keep quiet. When you see signs, it's important, and we all have a duty to speak up because we feel the grief when we lose a loved one or a client even because we didn't pick up on the signs and act on them.
Right.
Yeah.
Go ahead, Jennifer. Go ahead.
And I think to that point too, of a lot of times people might say like, oh, well, it's not my business to see what's going on with them. I don't want to get in their business. Suicide is everybody's business. I'm not saying that you need to go gossip to your neighbors or anything like that, but this is the time where you can butt in and say, I need to know what's going on. If you don't want to talk to me, you have to talk to somebody. I'll connect you with somebody. So this is the time to put aside our social norms of it you want to keep to yourselves and say, this is when we really need to come together and say, something's not right. Let's get you the help that you need.
Right. Let me give you a scenario. John Doe tells Jason Doe that he's depressed. His girlfriend left him, and he tells Jason Doe that I'm thinking about suicide. Jason's response is, "What, man? You crazy? You all depressed? You want to get over it, girl? Then get over it, man. Just get over it. Things happen. Life happens. Kill yourself over what? For who? For what? There's thousands of women out there. Come on, man. You're overreacting. And sometimes that may be the response that one may receive that people don't fully understand. So if you two want to comment on the significance of not downplaying someone's feelings or emotions because people take things in differently. I know he may have been in love with that woman. She may have cheated on him, et cetera, et cetera, et cetera. He's heartbroken. She was his main support system, his only support system. Sometimes people from the outside, they may not fully understand.
And Omar, that scenario that you gave is more common than not. That is a typical reaction that most people get when they do share that they're having thoughts of suicide. Oh man, get over it. It's not that big of a deal. But minimizing it, again, it reinforces that stigma. It reinforces that shame and that embarrassment that you have just for having those sort of thoughts. But a more appropriate response would be to ask more questions. So when, Jason, I think his name was, you said Jason and Joe Doe. So, when Jason said, you know what, man, I feel like I'm just going to end it all. I can't take it anymore. Then, Joe or John would say, well, how do you plan to do that? What are you planning to do? Just to get more information, just to gauge just how serious it is. But even if they don't get all of the information, just that person saying it alone is a red flag. That's enough to act. And that's enough for that person to reach out to the family members or even call 911 or the local crisis unit to get that person help.
Right. And I think to that point too, of making sure that, again, we're taking every threat seriously. And I think, Latoya, you mentioned this earlier, withholding any judgment when you're talking with somebody who might be at risk of suicide, because them saying to that person, oh, well, you wouldn't do something stupid or crazy or anything like that. If the person's already feeling down, that's only going to make them feel worse 9 times out of 10. So we want to make sure that we're withholding as much judgment as possible, letting them feel supported and cared for, and letting them express the feelings that they're having. Because sometimes putting it out there into words, it might be the first time that they're actually vocalizing what they're thinking of attempting to do.
Mm-hmm.
Right, Jennifer, through your work with the Mental Health Association, and Troy, you can chime in as well. How do one commit suicide? I mean, is it more prevalent in certain cases where you see someone commit suicide with self-inflicted gunshot, or are they hanging themselves, or are they overdosing on pills? Is one attempt more prevalent than others?
I actually looked at some data today to be as current as possible. The lethal means, so firearms, typically on average are about 50% of all suicides. That number goes up and down depending on the year as well, but it's usually right above 50% account for all suicides. And we try, I want to point out too, we try as hard as possible to sometimes pull away from what that method was and what those means were. Not
Okay.
focusing on how they did it, but sometimes focusing on why they did it. Because if we can figure out
Right.
why, maybe we can help somebody else who might be going through something similar.
Yeah, so Jennifer mentioned it. Number one is handguns. Not assault rifles, but handguns. I want to also mention too, Omar. We haven't touched on this, and I cannot think of the term off the top of my head, but there's a form of suicide that's more indirect or more passive that you usually see in the Black community. So it can be suicide by cop, provoking a situation with the cop to where you intentionally get shot, or, a rival in your neighborhood that, is more likely going to retaliate. It can be by not taking care of your health, taking your diabetes medication, or just some sort of, self-destructive behavior where your health deteriorates and you're intentionally inflicting that onto yourself. So when we think about suicide in the Black community, we got to think about that it's not always by firearm. It's not always by taking a large amount of prescription medications. It's really about, putting ourselves in a risky situation where someone else will take our life, or where a health issue can deteriorate to the point where we meet our demise.
Right. That's a great point. We mentioned psychiatric centers earlier. So for those who are watching right now, for the educational information, education and information, I want to, if you can elaborate on, once a person, let's say a person has suicide thoughts and they get admitted to a psychiatric center, what kind of treatment takes place while they're in the hospital?
So usually it starts with a psychiatric evaluation. So, they're given a comprehensive assessment to determine their risk level. If they're deemed high risk, then they usually, here in Maryland, I'll say, and this is probably standard across the nation, is that they're usually admitted to the hospital for 72 hours minimum, where they're being monitored, supervised 24/7, given medications. And then as they're in the hospital, if they are manageable and stable within 72 hours, then there's a plan of care that's put into place to make sure that they have services once they're discharged. But it's not uncommon for people, if their thoughts and they're psychiatrically unstable, that they transfer to a more of a longer term facility. Here in Maryland, people often are transferred to Shepherd Pratt, where they're there at least a minimum of 2 weeks, for ongoing evaluation.
Right. Okay. So I mean, are they getting individual therapy, or are they getting group therapy, or are they getting the medications?
All of the above. All of the above.
And I know in Delaware, I can't speak to other states, but I know in Delaware, just because our agency does them, we have somebody on our team who goes into each of the behavioral health hospitals and does monthly mental health presentations. So they're not only hearing from the staff there, they're also hearing from quote unquote outsiders who are going in and just letting them know what resources are out there. And just, it's another way of showing that the community is there to support you. I do just want to say too, that just know what the policy might be, because a lot of times people may go to one of the behavioral health hospitals and they just think, oh, I just want an evaluation and then I'll be able to walk right out. That's not always the case. So just doing as much research as possible, just so even when you if you start going to talk to a therapist or whatever place you're going to, or whoever you're speaking with, just do your research and know what the policies and procedures are. It will just help all around.
As we're speaking, I know Jennifer mentioned the word why they commit suicide. And one of the whys, the whys that I ask myself more so than often, is when a person is murder suicide, when they shoot and kill 2 or 3 people and then they end up killing themselves. I mean, that's just something that really drew on top of my head. I don't know if you two ladies have the answer to it, or if you want to address it, but I mean, that was a question that I've always asked myself.
Mm-hmm. No, I think that's a great question. I think that's a great question for the police. I mean, they're usually the first on the scene. So, they usually have more of a background because when that happens, I haven't had any clients personally who've, gone through therapy and had a murder suicide event following treatment. So, I really can't speak to that, but that sounds like a great question for the police. Maybe Jennifer can chime in.
Yeah, I mean, you would think with the amount of crime show documentaries I watch, I would have an answer for you, but unfortunately, I don't. I mean, every type of situation like that makes me sad, and I don't know if we'll ever understand it. If there's someone out there who can study the mind that would be able to look more into that, I don't know what the implications are, why somebody chooses that road, as opposed to just taking their own life. Not that we want that to happen either, but yeah, it's a tough one. I don't have an answer to that one.
Right, right. Both of you ladies touched on this earlier, which I want to elaborate a little bit more on, and that is teen suicide. I mean, children and teenagers are the most precious people in the world. We spoil them. We take them to get ice cream. We take them to the carnival, Disney World. Man, I mean, at 13, 14, and 15, wow, and you're contemplating committing suicide. The thought process of what makes a teen at that's such a young age think about suicide. So I mean, how often do we see teen suicide, I guess, in Maryland and in here in Delaware? We start with Jennifer, then Latoya.
Sure. Definitely too often. I think there's a lot of reasons that go into that. I did also, again, to pull up, just so I'm quoting accurate data, there's a youth risk behavior survey that's done every year nationally. And in the 2019 year, over 18% of high school students mentioned that in the previous year they contemplated attempting suicide. So they had those thoughts, and that's a lot of people when we break it down. And then it goes a little bit further that close to 9% actually went ahead and attempted, and that's not counting for those who did die by suicide. So I think it's something that's happening that we're not talking about. We're not talking about it early enough in schools. Too many places are shying away from it or saying, oh, that's a conversation they need to have at home, but maybe the parents aren't having those conversations with them. It's just way too many people. We are seeing a decrease in the amount of empathy that children are having for one another and an increase in the suicide rates. So when there's somebody who's having a fight, instead of going to get help and being a good bystander, we're seeing and doing that bystander intervention, everybody's pulling out their phones and making sure that the video goes viral. Or they're adding to it. They're being the person's hype man when that's not necessarily what they need. They need you to go get help. It goes back to, too, I think, we're seeing more and more bullying with social media. So what's happening in school is following you home. People are being bullied from people that they don't know. Sometimes they're people in 10 states away who they've never met before, but they're commenting on a picture. And there's just a lot of pressures. People are putting up their highlight reels online, and you're seeing kids say like, oh, I want that to be my life, but they're not seeing the bigger picture. They're not seeing that what the person's not posting. So yeah, we are seeing kids even as young as 5 years old talk openly about suicide, and they don't know the finality of it. I once had a parent mention this to me, and this is a story that will stay with me forever, that their child said to them, but in my video games, when I die, I can start over. So they don't realize that this is final. This isn't something that you can just take the video game out and blow on it and put it back in and move on with their day. So their brains aren't fully developed to understand the finality of it. And I think there's sometimes those rash decisions as well. You mentioned earlier, Omar, about in that John Doe story about saying, oh, they broke up with somebody. Sometimes for kids, they could go through a breakup at 13 years old and it could be the worst day of their life. So as parents and guardians and anybody who's working with kids, it might not be the biggest deal to you, but it could be the biggest deal to them. So trying not to minimize their feelings and their emotions, and knowing that, yeah, this might be like, okay, you're going to have so many others. What's the big deal? To them, this could be the worst thing that's ever happened.
Yeah, and it's not like our day where we could transfer schools and reinvent ourselves and kind of leave the bullies and all the drama behind us. The drama is following the kids. And, the more time they spend on social media, the more they're being attacked and they're trying to, mitigate the issue, but it's snowballing and it gets out of control. The bullying, it's not the cause for suicide, but it's certainly a contributing factor. When kids are being bullied, they're at higher risk for having suicidal thoughts and behaviors. They're at higher risk for experiencing depression, low self-esteem. And then Jennifer mentioned earlier about the brain development. They don't have that executive functioning. They don't have kind of like the cause and effect thinking. They're more impulsive as teenagers. And it's not even, it starts even earlier than the teen years, Omar. You mentioned 13 or 14. We're seeing it in 5, 6, 8-year-olds, elementary age kids who are having thoughts of suicide. But it's important for family members, just like Jennifer said, to not minimize it. If it's their drama, the end of their, I have a teenager, her drama is my drama. Oh my God, are you serious? I get into it with her because I feel like I need to be present and need to show her that, her feelings matter. And even if I don't understand, I can at least show empathy. But just monitoring our kids' thoughts and feelings, talking to them, monitoring their social media even, because that's where a lot of the bullying is taking place, unfortunately.
And I think too, it's also important to realize how much is changing, that it's very rare now that there is a parent who's home. A lot of times parents are working multiple jobs just because the cost of living has gone up so much, and it's not the same as it was when we were all younger, and things are just different. So less family dinners are happening. A lot of conversations are happening as you're picking up your kids, bringing them from one place and dropping them off somewhere else, or they're being raised by other family members or neighbors or whoever it might be. So there's so many other factors that play into this. So it's not just suicide isn't just a mental health concern. There's so many factors that we need to look at, that if we got other things done correctly, maybe there would be some lower suicide rates because of that.
I agree. Absolutely. I agree.
I want to talk about professionals in the field. Jennifer, at the Mental Health Association Delaware, you guys have a training, a suicide training. You want to talk about that?
Sure. So we actually offer a variety of trainings, everywhere from an hour to 2 full days. We have more general trainings. We have a Lifelines one and a QPR, which is question, pursue, and respond. And those trainings just go over a little bit of the background information, some of the warning signs to look out for, some of the statistics, and really how you can help. We also have a suicide alertness for everyone, Safe Talk training, which is a 3-hour course that takes it a little bit further. It starts at intervention with them. And our most inclusive training is our Applied Suicide Intervention Skills training. ASSIST is what it's usually called. And that's where we really go through an intervention with someone who's currently at risk of suicide. We make sure to stress in all of our interventions that these are in all of our trainings that these are verbal interventions. We always want you as a person caring for someone else to keep your own safety in mind. We will never ask an individual to put on a cape and go save the world. Just do what you can to be more aware of the situations around you, but also knowing your limits, knowing that if you're having a bad day, you might not be the best caregiver for somebody, or if you're feeling overwhelmed or bogged down with something, seeing if there's somebody else. We can't just let the problem go completely, but we need to make sure that we're getting other people involved when needed.
Right. Now your trainings, are they, are they currently online or virtual?
Some of them are done virtually, and then as soon as we get the clear, we can start doing some more in person. I will say it's hard to do suicide prevention online just because there's so much built into our trainings that builds on the connection and the open conversation. So we're definitely missing that in-person piece to it, but we're trying to do as much as we can to keep the community informed about what's going on.
Okay, and just another follow-up question with that. Is there a specific training for family members? And we talked a great deal of family members being able to identify warning signs and such. Do you do trainings for family members in particular?
Yeah, so our trainings are open to everyone. We've had actually a grandmother one time took the training because she was raising her grandchild and she didn't know what to do. She said it was so different from when she was parenting the first time that she needed kind of that refresher course of what to look out for. So yeah, our trainings are open to anybody. We have a youth training that we do, but our trainings that I mentioned are usually 18 and older. But I know there's other organizations who, in the support groups that they offer education classes specifically towards family members. I know NAMI, for example, offers a support group and an educational program for family members who are living with someone with a mental illness.
Mm-hmm.
Right. Latoya, I want to talk about post-treatment after a failed suicide attempt. There are a great number of people who attempted suicide but failed, which was a great thing. But I think they need that ongoing counseling and therapy because you never know, they may try it again. They're still going through some stressors. They're going through depression, stress, whatever have you. So if you could talk about those who may be watching about the significance of continuing ongoing treatment.
Yeah, and the ongoing treatment is necessary. It has to be a part of the plan of care. So if someone discharges from the hospital, they should follow up with an outpatient mental health specialist, even a psychiatrist for medication management. But for the therapy side, what we do is we help people manage their symptoms. So the symptoms of the depression, what triggered the suicidal thoughts, getting their family involved, developing, a suicide safety plan with family members so they can recognize what a person looks like when they're well, what are the risk factors, what they need to do to keep the person safe in the home, and also support groups are key as well. Just helping them get the support of other peers so they don't feel alone in this, have people that they can relate to, in regards to how they're feeling, but also how to manage those feelings and learning coping skills from through their peers.
And I'm so glad that you mentioned peer support groups and peers, because there are those who unfortunately may not have that family contact for one reason or another, and they do feel alone. So, I mean, it's very significant that they do find a support system in regards to support groups and as long as peers as well. I want to talk about, you mentioned teenage suicide. Wow. With the Mental Health Association, do you guys are you affiliated with someone who goes into the schools to counsel their fellow students, because it has a strong effect on them, especially if they were good friends with the student. I mean, I don't know if that's something that the Mental Health Association does. Latoya, I don't know if that's something that you do, or someone that does that in the state of Maryland.
So we'll go into the schools and kind of work with select groups of students. Those are the students who have been kind of selected by the administration of either people who would make good allies in the program, people who may be open about some of the mental health struggles that they're having, and they're just looking for ways to connect these students in a safe environment. But we'll also go into some of the health classes and do one of our Lifelines trainings to give the students the knowledge that they might not be getting elsewhere. Making sure that there's always the teachers in the room with us and the counselors in the room with us, because we know that when we leave, there's somebody there who was able to witness some of the emotions that may have been happening, and can do more follow-ups with the students, because that follow-up is so important. Also knowing that we do small group settings in schools rather than school assemblies, because we want to make sure that if we see somebody becoming emotional over what we're saying, that we're able to make that connection with them to get them the help that they need. But to your point, I know there's a lot of schools who are starting their own mental health clubs where they can work one-on-one with the students. So really, if there's a school, or if those of you watching are connected with a school, just making sure there's really good advisors for these types of clubs, advisors that are going to put in that extra effort to stay after and talk to these students when needed, and really be an advocate for them, because they may not be getting that support at home, and they may only be getting it in the school setting.
Right. I was going to say the same thing, is that we all need to be advocates in encouraging schools and basically demanding schools, address mental health with the children. I know that the health curriculum here in the middle schools, they do build in, depression, anxiety, certain disorders, suicide prevention. Our local crisis team here is very robust. They're very connected with our schools. So they often go into the schools. They've done several programs with students. So it really is a community effort. It's going to have to take families involved, specialists out in the community, educators, to see the importance of addressing suicide with our students.
Yeah, and we try to do parent programming too. You don't always have the turnout that we would hope for, but again, that kind of goes back to that. There's so many other things going on that until it's affecting them personally, they don't always realize that. And that's all of us. Until something impacts us personally, we don't always realize how important it is.
Mhm.
We talk about the schools, but I also want to get into employers because so I listened to your story earlier. You mentioned how the client that you comment on his fish tank aquarium and how he later committed suicide. Now that could be a strong, lasting effect, for the case manager, the social worker. So if you two can talk about the significance of employers having a counseling program for the employees who work with the clients, because you build that therapeutic relationship. You see them on a weekly basis for their meds. You may take them shopping. You do supportive therapy, individual therapy, cognitive behavioral therapy, and then all of a sudden they commit suicide, or better yet, where I work at, it was like, well, one occasion, I think one of the workers had found a client that committed suicide, so he had to leave work early because it was so devastating. So that worker, that employee, they need support.
Yeah, I mean that could be traumatic, for a person. It could be, and absolutely, we are on the front lines. We're seeing people at their most vulnerable, their most critical, and absolutely we can reach our breaking point. It's emotionally overwhelming for us, and employers need to recognize that. And if they don't, we need to recognize it within ourselves and seek help. I know for me personally, I have a therapist. I do monthly supervision with a group of social workers. So we need that support. And if our employers don't, encourage it or offer it, we have to seek it for ourselves, because this work, you can only handle but so much. And we need to be honest with ourselves.
And I think too, to that point, the more we can destigmatize mental health and suicide, the more we can change the language, and just encourage people to be more open about it. If somebody can go to their employer and feel comfortable that they can say, this is something that's going on right now, I might be a little late in meeting some of my deadlines, it could alleviate some of that stress and anxiety feelings that person might be having. So the more openness we can build, where you feel that you can talk to your employer without fearing that you're going to lose your job or have things taken away from you, that's so important. And I mentioned the language too, because, and I still kind of slip up from time to time, even moving away from using the term committed and moving to died by suicide, because we often associate committed with crime or sins or something with a negative connotation. Right. So the more we can have these open conversations and bring these points to the forefront, can help change how people feel comfortable talking about it, and can really shift suicide awareness overall.
This field that we work in, it could be emotionally draining, physically draining, but it also could be very rewarding. Both ladies have worked in your jobs for quite some time. I want to start off with Jennifer, then Latoya. Let's talk about the reason why you continue to work in this field. What is the rewards for you, and what do you get out of it?
Yeah, I mean, I think it's definitely something that being on sometimes the back end of things, so doing the education programs, we don't do direct services. So I don't see the immediate implications of the work that I do, but just knowing that I'll get emails from people or phone calls saying, oh, I used something you taught me in a training and I was really able to connect with my daughter or my sister or friend or whoever that might be. So I think something that keeps me with it is just knowing that how important it is. When you are able to make that connection with someone, we'll occasionally get a crisis call. And there is a story that will stick with me forever of somebody that I was able to connect with and prevent her from following through on a suicidal thought that she was having. So just being able to know that those days are out there, and that even on the days where I don't feel like I can give it 100%, just knowing that the next day is going to get better. And I don't know, it's hard because I don't see the direct implications of the work that I do, but knowing that I'm doing work that's hopefully making this a safer world all around.
Toya?
You know what? I've had a fire in my belly for mental health and treatment since, oh my God, since as long as I can remember. It's a passion. It's like second nature. It's something I believe in. I believe that we all need mental health. If our head is sick, our body gets sick. I mean, I don't see how, most of us can function in life without some mental health treatment at some point in our lives. So for me, I believe strongly in it. I think that it's important for all of us. I've seen individuals heal. I've seen families heal as a result of the individual healing. I've seen communities heal as a result of families and individual healing. So I feel like it's important to our society. It's important to all of us as individuals. And if we believe that and continue to push for it and advocate for it, I believe that we'll see positive changes in our society overall.
Right.
What we're seeing right now is anger, is fear, depression. It's an emotional response. And when people don't get the help that they need, they react irrationally out of emotions.
Yeah.
All right, I'm gonna give you ladies an opportunity for closing comments as we end the program. You can give the information of your respective agencies, the hours of operations, of the phone numbers, the website, and if you have any upcoming programs. So whoever want to go first, just go ahead and do it.
Sure.
Oh, go ahead, LaToya.
Sure. So the name of my agency is Work Life Behavioral Health and Professional Training, and we're located at 7310 Ritchie Highway, Suite 307 in Glen Burnie, Maryland. Our phone number is 410-487-6052. You can like our Facebook page, which is Work Life Behavioral Health. You can also take a look at our website, which is worklifebhllc.com. We also do trainings. We are a NADAC approved CU provider. So we have a training tomorrow on ethics. We also have a family peer curriculum that teaches families ways to be able to provide family to family peer support to help family members recover from mental health and substance use disorders as well.
Now, LaToya, now, is that training, is it for anyone who's interested, or is it for specific individuals?
Well, no, it's for anyone who's interested. We do offer CUs for people who are seeking a family peer endorsement, but we offer CEUs if you're a licensed social worker, drug and alcohol counselor, professional counselor. So it is national. So our CEUs are recognized, nationally through NADAC.
Okay, what's the website, phone number once again for people who are interested?
Yeah, so the website is worklifebhllc.com. If you go on our Facebook page, Work Life Behavioral Health and Professional Training, if you like the page, you'll see events posted, training information posted as well.
Okay, Jennifer.
Sure. So MHA is a statewide agency, so we cover all of Delaware, but we are based out of Wilmington. So our office is in the Community Service Building, which is in downtown Wilmington across from Hotel DuPont. We are Monday through Friday, 8 to 4. Our phone number is 302-654-6833. And if you visit our website, which is MHAINDE.org, so it stands for the Mental Health Association in Delaware, there's access there to find out when upcoming trainings are happening, to learn more about our organization, just to get more familiar with who we are and the services that we offer. But we always have online training opportunities coming up, both suicide prevention, general mental health, and also with our peer program as well. So all of the information can be found at our website.
All right, ladies, I'd like to thank you both for being my guests this evening. You were awesome guests and you provided a lot of information. It was awesome. So thank you once again. And thank you, the audience, for watching. So like, subscribe, and share. Okay, ladies, if I do future shows on mental health, I'm gonna give you a ring.
All right.
Sounds good. Thank you.
Or email. All right, thanks again, ladies.
All right. Thank you,
everyone.
Omar. Bye.
Bye-bye.